I'm Richard Lamour. I'm an orthopedic surgeon here at Olympia Orthopaedics, and we're going to be going over fitting of a common brace we use after many knee surgeries. So this brace is a Breg T-scope. A lot of these adjustments won't really need to be made by you, because when you wake up from surgery, you'll have this brace on. If there's any adjustments to the brace, we just want to make sure you feel comfortable doing that. Actually opening up the brace and just looking at the pads, the wide pads go on the thigh, the narrow pads go on the leg, and then these circular pads go at the center of the knee. So, and then these circular pads are right where the hinge is, and the hinge is going to be centered in the knee in all planes. The length adjustments, you really probably won't have to change this. This will be set by your surgeon, depending on the length of your leg. It'll be set there, but if it pops open because it rubs up against something, you can always just lock it back in place. And we just want to make sure the length of the brace is equal throughout. There's the same setting at the leg side, on the other side as well. And then the hinge has a master lock, this orange tab, and if you unlock it, it'll allow for motion in the brace through the hinge. Most of the time you'll wake up from surgery and you're gonna have their brace locked at 0 degrees in extension, so your leg will be straight. So you wanna keep it there, but when it's time to begin range of motion, then you can pull this tab back and that's going to unlock it. When you need to lock it, you line up the orange tab with this orange line with 0 on this little etching, and that'll keep your knee at the 0 degree setting, which is, straight position. If there are other settings that are set depending on your surgery, those will be set by your surgeon. But if they ask you to change that for any reason, then you just pull this tab out and you pull it and rotate it to the slot for the degree that you need. So we're going to lock this back in the 0 degree position, which is helpful whenever you're adjusting the brace, so the brace is stable and it's not bending on you. It just makes it easier to make any other further adjustments. So once we've gotten the brace lined up with the hinges lined up where we want them centered in the knee and the frontal and the side planes, we are going to begin hooking the brace in place. I usually like to do this so we can show you again, but I usually like to start off with the bottom straps. So I'll bring the brace together and we will hook this guy in place and then secure that strap so the brace comes together, and then secure the strap to itself. Sometimes you have to wrap around to secure the Velcro to itself. Again, if you had to make any adjustments to tighten the strap that goes around in the back, then you kind of undo this little locking mechanism, pull out the excess strap that's in the back. You can see that will put a little tension, and then you lock it, and then we will reapply the hook. Thanks again for watching the video. Hopefully this helps get a better understanding on taking care of the brace and learning how to use it. We're looking forward to keeping your life in motion.